You mentioned that you're 26 weeks along, you're having your 4th baby, and first of all, congratulations on that. But you mentioned that you've been having some relentless right-sided pain, and you talked with your OB provider about it. That was good to do, because we always want to make sure it's not something emergent that needs to be addressed as soon as possible. They talked to you about round ligament pain. The round ligament pain is caused by basically growing and stretching of the uterus. The uterus isn't just suspended in the abdomen, it's attached to different parts by ligaments, and one of those ligaments is the round ligament. So round ligament pain is felt usually in the groin area, in the tract that goes from your pubic bone to your outer hip, and it can be very tender. It can range from just being achy to being so intense it takes you to your knees, but one of the cardinal signs is that it's one-sided, and it's usually associated with a sudden change in movement. So if you're getting up off the couch or the floor, or getting out of the car, or you change directions quickly or something, those are all normal times to experience it. You're pretty convinced that it's not round ligament pain, and so you're wondering, what else could it be? Of course, we always have to worry about preterm labor first when a pregnant woman talks about having abdominal pain. The good thing with you is that it's on one side, and so, and actually if you've been feeling it for a while and you haven't delivered your baby yet, then that means that it's probably not a contraction. And since you have babies before, you've probably had those and know what they're like. You feel abdominal tightening, lower abdominal cramping, a lower backache, and this is felt on both sides of your abdomen while you're having the contraction. It's not felt on just one side or the other. Other things that we explore when a woman comes in having right-sided pain is appendicitis, gallbladder pain, and this is, again, all dependent on the location in her abdomen where she's feeling the pain. Urinary tract problems, and those can range from a bladder infection to a kidney infection, or there's something called hydronephrosis that's really common to have during pregnancy, where the little tube that goes from your kidney to the bladder gets kinked or blocked because of the increased abdominal pressure from the growing baby and uterus. And so this causes basically a backflow of urine into the kidney. It swells a little bit, and this causes pain, and for some women this is significant. Another possibility is kidney stones or constipation, and if all of these have been ruled out, then sometimes we worry about infection or bleeding problems. Really, the only thing you can do is talk with your OB provider, and after asking you more specific questions about the location and characteristics of your pain, they'll be able to decide what it's most likely due to, and based on that, if further investigation or treatment is necessary. It very well could be round ligament pain like your doctor said, but if you feel like that's not it and you're concerned, call your doctor back and be candid about your concerns, and again, they can talk to you more about it. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.